see. You can come around here as well, or it might be easier to see than upside down. Okay, so first thing that you guys need to do, okay, you need to open up, obviously, the chest and the belly of the cat. So most of the cats have already had part of their neck open because that's where they inject the latex for the vessels. So what you're going to do is you're going to take that opening. I want you to find midline on your particular cat, and I want you to cut maybe 1 to 2 millimeters to the left of midline when you guys are cutting through the ribs. When you cut through the ribs, okay, you're going to use a scalpel blade. Hopefully a sharp one. If yours is really dull, now's the time to change blades. But you can use a scalpel blade, find midline, just go like a hair over to the left, and then basically you're just going to cut directly through the ribs. You'll be able to feel each rib as you cut through it, and then once you get to the last rib and you start on the belly, I mean the belly's really thin, so you can just continue with a really easy scalpel cut down the middle, or you can just use your scissors, whatever you want to do. Okay, once you do that, you have to go around each side on the last rib. So you want to you can take your scissors or your scalpel and just cut around the last rib laterally. Okay, then when you open up, you're still going to have, what muscle is this? Diaphragm. You're still going to have the diaphragm attached to the ribs. So literally you have to just take your scalpel blade and skin the diaphragm down off of the rib. Okay, so here it's still attached, just to show you. So you basically get your scalpel in there and just skin him down so that he sits on top of the liver. Okay, and then he'll get out of your way. And then once you do that, that's when you need one of these three, the rib cutters. Okay, so the ribs are going to want to stay closed. In order for them to relax open, you basically have to take one side at a time, and as medially as you can on the cat, basically take the cutter and just snap through each rib. Okay, so you don't want to go directly over the middle of the spine. You want to just be as medial on the actual rib as you can. And in doing that for each rib, okay, you'll get the rib cage to relax open. So you can see these have all been cut. I would actually go a little bit more medial here, but that's okay. If there are any shards of bone sticking up, okay, just make sure you trim them so that they're not poking your fingers the entire time and annoying you. Okay. So then that'll let the rib cage open up a little bit more relaxed. And then you guys need to remove a little bit of the pericardium, okay? And also you're gonna see the thymus gland, and you also have neck musculature. So you're gonna have to remove kind of piece by piece and kind of peel away the thymus gland, because he's gonna be sitting right on top here of all the major vessels that you need to identify. Okay. So once you've done that, what I do to start, these are lungs. So lungs might get in your way if you have the little T-pins, these guys in your kit, and you want to like push a lung out of the way and pin them back, you can, because they'll just be flip-flopping all over the place and driving you nuts. Okay. All right, so you want to look for the big guys first. Okay, the three big ones that you want to look for coming off the heart. On the venous side, what is this big one? Superior vena cava. Okay, so he's going to just jump out at you. Then the first arterial branch is going to be brachiocephalic. Okay, and then the second arterial branch is going to be left subclavian. Okay, on the cat. So remember, there's only two main branches off the heart, and then brachiocephalic itself, okay, will further branch into left common carotid, right common carotid, right subclavian. Okay, so when I'm separating out vessels, I kind of move things aside. I'll just get my blunt probe underneath and relieve some fascia. Okay, so I don't use a lot of scalpel. Interesting. That could be an internal jugular vein. Okay. All right, so once you've identified both subclavians, both common carotids, brachiocephalic and SVC, okay, SVC first initial branching here is going to be right and left brachiocephalic veins. Okay. Now the internal mammaries, which is why you guys are cutting just left of center, on this demo cat have been detached, but hopefully on your cats they may still be attached to the rib cage. If so, okay, the right internal mammary comes off of the right subclavian. The left internal mammary comes off of the left subclavian. And they both should go across and over, okay, to the rib cage. So we'll see who has them still intact nicely. And the vein right here, big, huge internal mammary vein just coming, there's just one just coming right off of SVC, okay? So then for the veins, we have the brachiocephalics. They will then continue out into both arms, okay, but you're going to have this big major branch that goes up onto either side of the neck. This is external jugular, okay, usually comes up here and makes a union with another vessel called the transverse jugular, which I believe is on your list, okay, so we'll see who's got that connector. Okay, now internal jugular, like I said on the cat, teeny tiny. Okay, see this teeny, teeny, teeny blue coming from here? That's internal jugular on the right. I'm surprised it's even still showing, okay? So depending on the cat, may or may not see it. I don't see it on my left at all, so it's pretty much gone. And sometimes these vessels, you can see where the latex was, they may have ruptured or they may be barely hanging on, so you just have to be careful when you're separating things out and clearing off tissue, okay? So once external jugular branches, brachiocephalic then becomes subclavian. You then follow it out into the armpit, it becomes axillary, and then out into the arm, it becomes brachial. Okay. All right. So off of the subclavians, okay, artery, the first branching that you're going to look for, it's right around the first rib, okay, is called vertebral. So vertebral artery, we have one on the left, we have one on the right, okay, will branch and head up into the neck, okay. Second branching, usually right nearby, costocervical, which is right here, okay. So when I'm identifying vessels, I usually just kind of use my forceps. I'll pull on kind of the main vessel, and then I'll get my probe underneath and kind of clear off some fascia so that I can see what vessel it is I'm identifying. So vertebral first, costocervical second, third branch, thyrocervical. Thyrocervical, you're going to follow up, 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 and then it branches further into transverse scapular artery, which also has a transverse scapular vein that follows it, but transverse scapular vein branches off of external jugular vein, okay? So transverse scapular artery comes off of thyrocervical, transverse scapular vein comes off of external jugular, okay? All right. So after thyrocervical, next on the diagram is going to be ventral thoracic. Okay, ventral thoracic goes up into the pectorals. It's much clearer on this side. Okay, so you can see the artery vein combination here. Ventral thoracic going directly up into the pecs. So when you go out and into the arm, I basically open up the musculature like a book. And I just follow whatever vessel it is I'm looking at, and I follow it out into the arm. Okay? Okay, so after ventral thoracic then, the very last branch that you're looking for is called subscapular. Subscapular artery dives into the posterior aspect of the arm. Subscapular vein follows it. But like I said on the cat, subscapular vein is huge. All right, so he's a huge branch, and he follows the artery. So the artery is going to branch a little bit later down the highway, but subscapular vein should lead you to wherever the artery is coming off of. This is technically now in the axillary region. Okay. Okay. So now out here would be brachial artery, brachial vein. Okay. So just remember for veins, first main branching off SVC is brachiocephalic. Once external jugular branches, it then becomes subclavian. Into the armpit, axillary, into the arm, brachial. And then the very last branch that heads down towards latissimus dorsi is long thoracic, artery and vein combo. Okay, so that should head downward. Subscapular will head up and back. Okay, thyrocervical, transverse scapular will be up into the neck and going up into the posterior shoulder blade. Okay, so to start, clear off pericardium, SVC, brachiocephalic, left subclavian. Okay, off of brachiocephalic, you need to identify 3 further branches. Right subclavian, right common carotid, left common carotid. Okay. Then from there you can start with your vertebral, costocervical, thyrocervical, ventrothoracic, subscapular, and then long thoracic.
Where's the
Zygus we'll do tomorrow. Remember, zygus is down into the thorax, so won't even hit that yet. So let's just do arm, okay? But first, remove a little bit of the neck, just left of center. Use your scalpel blade, cut through the ribs, cut through the belly, either side, and then rib cutters.